many of you would wager your life on a coin toss? Well, sadly, that's the statistic that hundreds of thousands of women worldwide are given each year when they're diagnosed with ovarian cancer. That means a woman diagnosed today would only have about a 50-50 chance of seeing the year 2026. Now, the reason behind this low number lies partially in the treatment. While one woman may respond remarkably well to traditional chemotherapy, another of the same age, the same diagnosis, and the same disease progression may show little to no response at all. With this diversity in mind, it's clear that we can't keep applying a one-size-fits-all treatment strategy towards these women. We need treatments that are tailored to each individual. We need personalised treatment. But how do we get there? Well, we know that the efficiency of anti-cancer drugs can be increased when we load them inside of teeny tiny drug carriers called nanoparticles. And you can think of nanoparticles almost like tiny cars on a highway, carrying their passengers, or in our case the drugs, and protecting them from the outside environment until they reach their destination, the tumour. Now, unfortunately, in their current state, these nanoparticle cars are lacking a vital component. Whilst they may have their passengers in the back seat, they're still missing a driver. The nanoparticles rely on passive movement alone to get them to the tumour site. Or in other words, the car's relying only on the flow of the rest of the traffic in the highway to get them to where they need to be. As you can imagine, this is really inefficient and means that the passengers can end up at the completely wrong destinations. The drugs can end up at the wrong places, like the brain or the kidneys, for example, leading to an array of horrible off-target side effects, things like pain, hair loss, and kidney failure, among many others. But if we were able to properly equip these cars with their drivers, then we could make sure that our drugs always end up right where we need them most. And that's what I intend to do in my PhD research. By attaching a specific targeting molecule, or in other words, our driver, to the surface of our nanoparticle drug carriers, they'll be able to actively seek out and infiltrate ovarian cancer cells to release the chemotherapeutic drugs. Not only does this make the treatment more effective in destroying cancer cells, because it means more of the drug actually reaches the target site, but it also has the potential to reduce some of those horrible off-target side effects that are associated with chemotherapy. And the beauty of the system is that for each different patient, we can use a different targeting molecule that is tailored towards their cancer, a personalised treatment. So, by making these strides towards patient-specific treatment, we can rest assured that with more research and time, these women will no longer have to wager their lives on the flip of a coin. Thank you.